Today we'll talk a little bit about dermal fillers. Dermal fillers are sort of a category of injectable that's often confused with things like botox, which is actually a separate category. Dermal fillers are things you've heard about, probably like there's a few commonly known brand names such as Restylane, Juvederm, Radius, Voluma. There's really a large number of these different fillers, and they're really used for slightly different purposes. But the thing to keep in mind is that in general, what they're really trying to do is essentially really just fill an area that has kind of been depressed over time. So typically, the patients that I see for dermal fillers are patients for whom there's a specific line or a specific area of the face that's kind of lost some volume over time. Very commonly, these are the nasolabial folds. That's something you hear very frequently. The sort of marionette line areas, sort of at the corners of the mouth. Sometimes people have specific lines, like a line that's been etched here over years of constant frowning or just with age, or even some dark etched, sort of etched lines on the side of the eyes where the crow's feet are. In those cases, we can use dermal fillers, and really what those are, it's an injectable that really goes into the area, just lifts up and plumps up the skin so that those lines are really not as noticeable as before. In my experience, it really doesn't completely disappear the lines, but it really helps to make them a little bit softer, and so I think that's nice because it looks a little bit natural. And as the key with all aspects of plastic surgery and with injectables, the key I think is to be conservative and really to try to get a nice natural correction, not to overdo it. I think we've all seen people who've had too much filler injected and it doesn't look good and it doesn't look natural. And I think so the goal really should just to be aim for sort of a conservative improvement. Best candidates for the procedure, patients who have a very specific area of the face that they think they would like improved. Very often my patients will come to me and say specifically, yeah, this really bothers me, or this specific line, can you do something about this? And they've really kind of thought about it and looked at their face and decided where it is that they think they can get an improvement. Sometimes patients will come to me and just ask me to take a look and see what I think is best, and I'm happy to do that too. I think sort of working with patients together to decide what will be the good areas for improvement, that can lead to good results. Procedure itself is pretty straightforward. It's injectable just like Botox, and so really what it is really just putting on first like a numbing cream. In my case, I use a triple anesthetic numbing cream that makes things more comfortable for the patient, and giving some time for that to absorb into the skin and make things more comfortable, and then really just going in and very carefully injecting the filler into that area. I use a combination of a sort of a serial puncture versus a threading technique. It's sort of my own thing that I think works a little bit better. But every surgeon and every doctor does this really has their own technique, and so I think that's what's worked well for me. Probably takes about half an hour on average, really depending on the number of areas that need to be injected. I think it's important to take your time and do things in a careful fashion. After the procedure, what you can expect, the filler does swell a little bit. Usually bruising is very, very uncommon, but swelling is common. Usually swelling for like just a couple of days. After a couple of days, it will come down. Initially, in the first few days, it can feel a little bit raised, can look sometimes even a little bit red or a little bit firm or bumpy. I always tell patients nothing to worry about. Just go ahead and ice that area. After a few days, and especially after that first week, all that swelling comes down and things soften up quite a bit. At that point, if patients still have a little bit of firm areas, I just have them do a little bit of massage, and I have a special technique that I sort of teach them to do. So overall, I think with all those ideas in mind, you really can get very nice results with dermal fillers, and it's a very straightforward procedure to do.